Well, guys, it is not the first thing you want to hear on the most romantic day of the year, but there are conditions that could kill the mood, such as low testosterone, erectile dysfunction, and incontinence. They're embarrassing, but common in men. So how can they be remedied? Here this morning is Dr. Singh with Urology Austin. Good morning to you.
Good morning, Erin.
Happy Valentine's Day as well. And you know, love is in the air, so a lot of guys might be thinking about this as well. So talk about the three conditions that we just mentioned. Kind of walk us through what are the symptoms.
Absolutely. So for men, there are three factors that play together that can affect romance, and prostate health is one. That relates to sexual health and hormonal health as well. With respect to the prostate health, there are a lot of urinary symptoms related to that. And the way I explain it to patients is that if a person's constipated or has diarrhea, it affects their romantic life. And in the same sense, if a person has to use the restroom frequently or they have trouble emptying, it can affect how intimate they want to be. And there are medications and other therapies for that. And sometimes it happens gradually over the course of several years, so it's hard to understand that that's affecting the romantic aspect of life. So that's a very important aspect. It affects sexual health. And in terms of hormonal health, it's important as well, because if a person's testosterone is low, it can affect their desire for intimacy.
I feel like when it comes to guys, they take a much longer time to get to the doctor. So women might go more, and you know, right when they know something's wrong, they're in there, you know, setting up an appointment. But when it comes to guys, they wait a little bit longer or are a little afraid of the process. Would you say that is true with what you see with patients?
Absolutely. In fact, oftentimes it's several years, and the comment that I often hear is, you know, I was waking up my wife and she thinks I'm taking too long when I go to the restroom at the restaurant. And so their wife is often the motivating factor for them to come in.
So with some of these things that you mentioned, I know we covered a range of conditions here, but are there some pretty simple, easy fixes once guys do get to the doctor?
Absolutely. There's some medications that within 2 or 3 days can make a big difference. Waking up 4 times a night, straining to urinate, it zaps their energy really between the thigh and the belt buckle. It can really take away energy in terms of trying to urinate, and some of the medications can make a dramatic difference within less than a week.
Well, Dr. Singh, we are already out of time, but I appreciate you coming in this morning, and we're going to have additional information about this topic on our website a little bit later this morning with this interview at KXAN.com.